Hi, and welcome to Kudzi Chronicles podcast. I'm your host, Kudzaima Shaya, and today I am so honored to be joined on the podcast by someone who has a very long list of accomplishments. She holds a PhD in epidemiology. She is doing a master's in public health, and she has a degree in pharmacology. She's also a lecturer and a mom. Wow. Miss Mwila, I am so excited to have you on the podcast. Thank you for your time.
Thank you. I'm more excited actually because my own student is interviewing me. The student that I teach pharmacology, I always encourage students to diversify, to do other things despite the main program that they are doing.
Yes,
I'm really proud of you.
Thank you so much, ma'am. Okay, so I think to start our interview, I'm going to ask you to take us through your journey at UNZA, because now you have three things going on. You have pharmacologist, you have epidemiology, you have public health. So what exactly were you doing at first when you went to UNZA?
Okay, first and foremost, the degree at UNZA, it came somewhere in 2001. There was no degree in pharmacy at UNZA.
Okay.
So pharmacy was at Evelyn College.
Okay.
So it's where it started as a pharmacist.
Okay.
Yes. So first and foremost, my background itself, it has ups and downs.
Yeah.
You'll be shocked.
Take us through it. Tell us everything.
So what happened is, first and foremost, I wanted to be a doctor.
Okay.
That was my plan.
Yeah.
So when I was at secondary school, I was motivated. My sister was a nurse, and she would talk about drugs. So I said, I would love to be a doctor. She's a nurse. I want to be a doctor to go above her.
Yeah. Yes,
so I started working very hard when I was at secondary school. I was at Kablonga Girls. And now when the results came out, I was disappointed. I expected to get 6 points. I didn't manage.
Oh.
And for medicine, you needed 6 points. So somehow it was a drawback. I was really disappointed. I was depressed. And then my elder sister said, no, you can still do something relating to medicine. That's your passion.
Yeah.
It may not be medicine. So that's how she connected me to Evelyn College at that time.
Okay.
They were giving me, pharmacy was not there at UNZA.
Okay.
It was only at Evelyn. So that's how I went there. Unfortunately, again, the diploma was full. I was told that it's full, I can't go in.
Uh-oh.
So that was another drawback. So lucky enough, while we are complaining, while we are saying, why? And then the same person we are seeing said, there's a new program we are bringing, it's a certificate.
Okay.
You can go in, and then next year, because they said the diploma, you have to come in next year.
Okay.
Instead of you the whole year just sitting. So that's how I enrolled for the certificate. That was in 1999. What were you doing then?
I was not born yet, ma'am.
That was in 99.
Yeah.
So I did my certificate in pharmacy, and then I started working at UTH, and then I went back. Because remember, I went back to do the diploma.
Yeah.
And I did the diploma. And then now the degree came at UNZA. And then at that time, it was competitive. There were a lot of people who had done the diploma, they want to do the degree.
The degree now.
So us were like behind. So we said, okay, we'll wait. It was competitive again to go in at UNZA.
Yes.
I tried, I wasn't taken, so I let it be. And I started working at UTH as a pharmacist, as a pharmacy technologist.
Okay.
Because the diploma that I did at Evelyn, I started working as a pharmacy technologist. And also I would do part-time in retail, I would practice. Yeah. Until the time came, I never gave up. You know,
you never
in
give
life, even when you experience maybe the plan that you had is not working, whatever comes up, try it. You never know what is ahead.
Yes,
so I pushed, I applied at UNZA, and I was picked.
Oh.
And I started my journey. And that time, actually, I was married, and I had one child.
Uh-oh.
Yes, so I enrolled as a mother.
Wow, ma'am. How did you
I never gave up. Yeah, so I enrolled, and I started the degree in pharmacy until I finished. And after finishing, I used to work, I started working at UTH Obs and Gyn.
Okay.
Women and newborn there. I was working there. And when I was working there, we would receive students from Apex and also from the University of Zambia. And, I never thought I would be a lecturer, actually.
Yeah.
I never thought I would be a lecturer. So students would come, So in life, whenever you see something coming, even something that it comes close to you that you need to do, you just have to do it. You never know where it will take you.
True.
So it would help those students who are coming for internship. It would help them because when they finish, they come for internship. And I used to teach them, not knowing that's where my lecturing was being shaped there. We just help them. There's this topic they present. We take them on the major word round. You know those pharmacy students. We go for major word round, just like that. Not knowing that that's where I will learn how to lecture. And then at some point, it happened that a friend of mine did the master's in pharmacology at UNZA.
Yes.
So I thought, these students that I interact with, maybe let me do my master's. But I didn't even know why I was doing my master's. Just say, let me do master's as well.
Yeah.
That's how I enrolled.
Why not?
Yeah, and it was tough. The master's in pharmacology, it was very tough. Most of the people are not graduating. So when I told my friend that I'm applying for master's in clinical pharmacology, they were saying, why bother? People don't graduate at UNZA. Why waste time? A lot of people have tried. And then I said, if they didn't do it, I will do it. So that's how I went. And we were the 4 of us for pharmacology. Others were doing physio and so on.
Yes.
And it happened that towards the end, I was alone.
You graduated alone?
They gave up. I was alone. And towards the end were the 2 of us. And then my friend was saying, this thing is hard. I think these people are playing with us. Me, I've stopped. I said, but why leaving me alone?
Yeah.
So the time I graduated for master's in clinical pharmacology, I was alone.
Wow,
People had given up.
In which year was this?
And what happened that time was, what happened was that the way it was is like, their lecturers, they would not care whether you graduate or not. Even if one can graduate, it's okay.
Wow.
So what happened was, you're like, you really have to push for you to graduate.
Yeah.
That's the way it was. So me, what I said, when I was starting this program, they were saying people don't graduate. And these 3 of my friends, they've left that people don't graduate. Me, I said, if these people, they don't graduate people, they will be tired of me.
Yes.
I'll be on them until they say, I think this one is stressing us. Let's allow her.
Yeah.
And that's what I did.
Wow.
I just had to put pressure on them.
Wow,
I had to work hard. And that's how I graduated alone.
Wow, man.
That was in 2020, somewhere there.
Okay.
2020. That's when I really, because you can finish, but now the graduation, I missed the other graduation.
Okay.
So I graduated, I had to graduate in 2020.
Ma'am, that is so inspiring. You're teaching us a lot of things, ma'am.
Perseverance.
Exactly. When you want something, go and get
Yes.
it. Exactly.
Yes. And actually, afterwards, I realized that God knew best what I wanted to do.
Yeah.
My passion was academics, not on the word. So if I did medicine, I don't think I was going to enjoy myself.
Because you love what you do now.
I love academics now more than anything.
Yes.
I do go for major word rounds. From UTH, I take students, but I think the word is not my portion.
Oh.
I'll just go there, help students come back, but not being there 100%.
Yeah.
I enjoy lecturing.
Ma'am, I
so
love
God
that you
foresaw
found
that.
what you
That's why
love.
I did pharmacy. Yes, so that I could teach pharmacology.
Oh, wow. Ma'am, what can you say about multitasking? Because you're a lecturer, you're a pharmacist, you have a PhD in epidemiology, you do
I'm
your
also
master's.
into entrepreneurship. I run a retail pharmacy.
Exactly, and you're a mom.
Yes.
So what can you tell us about multitasking?
Okay, what I can say, I found myself in multitasking, not really that I planned. It just happened that, somehow one of my weaknesses is I'm workaholic.
You're
I don't
workaholic.
Yes, that's one of the weaknesses that I have. I want to achieve. When I want to achieve something, I have to achieve it.
Yeah.
See, so it happened that just like I said, I'm proud of you.
Yes, ma'am.
Besides what you're doing, you need to try a lot of things because you don't know what can help you. Okay.
True.
So when I finished actually with the retail pharmacy, I started even earlier before I even did my master's.
Yeah.
I opened a retail pharmacy and it was doing very well. At that time, there were few.
Okay.
Yes, so I was into entrepreneurship and I benefited from that business actually. It really helped my family here and there, and my husband was also there to help me in one or the other.
Yeah.
Yeah. So with multitasking, it's like it's just within you. You want to achieve things.
Yes.
You have a passion.
Yes, ma'am.
So when you have that passion, you don't even get stressed, okay? because you are thinking, okay, there's this business. If I focus on this business alone, what if tomorrow it's not doing well?
True.
Let me do my master's. So I thought of my master's while doing the business. To say, business sometimes it's not the same. It changes.
Yeah.
So I said, what about my career? I need to improve it. So I did my master's. And then after doing my master's, and then now I thought, because I saw my friends who had done the PhD, and then I was saying that in academics, just being called Mrs. I would want to be, when you look at the timetable, you are written Mrs.
Yes.
Your friends are called a doctor.
Oh,
so why not me?
That's where the motivation
why not
came
me?
from. Yes.
I also want to do a PhD. So now what happens was, because I have a master's in pharmacology.
Yeah.
And then I was telling myself, because earlier, before I started teaching at Texila, I was teaching at Unilas.
Okay.
And I started with lecturing public health students.
All right.
That's where I developed interest.
Okay.
Because I used to teach public health students, and I would interact with a lot of people in public health. And at some point, these students, I'll be among the people asking them when they are defending their research.
Okay.
So slowly I started developing interest in public health, and then I asked myself that public health sounds interesting. As I interact with these students, why can't I diverse? I do something else. I try to be in 2 programs.
Yeah.
So I thought of doing PhD in epidemiology.
Wow.
Yes. So that's how when I applied, I was picked. So when I started PhD in epidemiology, I started asking myself, I'm starting from the top there.
Yeah.
So how do I understand things? Because I'm a pharmacist, I'm a clinical pharmacologist. So I started saying, public health is a bit new. So when I started data collection for my PhD, I said, I need to enroll for MPH, Masters in Public Health, so I have a good foundation. But it was not easy. Because PhD was tough. I was also doing business, and also I was lecturing.
Yeah.
You see, I was lecturing, and also have a full-time job at UTH. Remember, I'm a pharmacist.
Yes.
I started working as a pharmacist at UTH, like I said, in Obs and Gainde.
Yeah.
That's where I work as a full-time. I have a full-time job there. So now it was an issue to say, how do I manage these things? If I start this MPH, why survive? It wasn't easy. And then I was telling myself to say, and then I have to pay money. Why won't I lose this money?
Yeah.
I start, in the end I fail. Because, PhD, it's so involving. I'm lecturing, UTH, I'm working, I have this business, my kids, my husband. Then I said, I'm going to take a risk.
Wow.
I'm going to take a risk. I've done it before. So that's how I started. I went into stage 1 of Masters in Public Health. I'm telling you, it was the best decision I've ever made.
Yeah.
I understood my PhD better. So I would encourage people, when you're doing a program that you don't understand and there's something you can do to learn, to understand it better, don't hesitate.
Do it.
I'm telling you, I learned my statistics. The time I was analyzing my data for my PhD, it was a walkover.
Yeah.
The time I was defending, I had a good foundation. I became a public health specialist now. It's like I was knowledgeable in public health itself.
Yes.
And I defended my work very well for my PhD.
Yeah.
So, but it wasn't easy. Remember, I was doing assignments. And it's very, very compressed.
Yeah.
There's everything in there. There's no time. It's compressed. I had to do epidemiology itself, biostatistics, health promotion. There's a lot that I had to do. Project management, a lot of courses.
Yeah.
Assignments, tests, exams. Oh, it wasn't
Hard.
easy. I'm telling you, at some point I used to feel like I was going crazy. Like, you needed to be admitted at China Mental Hospital. It wasn't easy.
Yeah.
But where there's a will,
There's a way.
Yes, that's how I
100%.
survived.
Yes, ma'am. Ma'am, I love your journey. That is so inspiring.
Thank you.
Wow, ma'am. So, what are some of the differences that you'd say you're seeing now with us students, and how are we different from when you started at UNZA, maybe in the early 2000s? How is it different now? Because we are AI students. We have ChatGPT, we have Meta AI. How is it different, or is it the same?
When I look back, even the new lectures that you'll be having in the next generation, you guys, you have challenges.
Yeah.
Our generation. I'm sure you can see sometimes how I'm so serious about things.
Yes.
The way I want them to be.
Yes.
It's because of my background.
Yeah.
The way we used to learn, that time People would just detect you are writing on your own. There was no AI. Would not really use phones where phones were not helping us.
Yeah.
We used to go in the library on a serious note. You look for textbooks to read.
And you read.
No, we used to read. You have to be in the library. Home, there's nothing.
Yeah.
Phones that time were not so, things were not advanced. So we depended on being in the library.
Yeah.
And we used to go there. You see, on the library at that particular time was important. Physically, you go there. You used to study from the library.
Yeah.
You see?
Yes,
and if it's assignment, there was nothing like AI. You have to read this, you rewrite.
Yeah.
If it's your Google, if you're going to Google, you go in the library. We didn't have access into internet at that time.
You had
we had phones, but there was no internet there.
Oh, yeah.
Internet was not connected. So internet, okay, the library had. We had access.
Okay.
You go in there, if it's in the library, you go in for your assignment. You Google, you start it. And even when you Google, it's not straightforward like AI. The way you do AI, you give it a question, it gives you everything.
Yeah.
First, you have to again structure it. You get the data which is just raw. And then now you start putting things in place there in line with the question that has been set. And it was hands-on. It was hands-on. And our classes, the way it used to be, even the people who are lecturing us, when they come, it was very intense, And I remember when we were learning about biopharmacy and medicinal chemistry.
Yes.
We had those odd lecturers. Those were so serious.
They're not
No
playing.
jokes. When they come, so attendance has to really be good.
Yeah.
The attendance is not good. You just say, no, where are these people? And they'll even know he's not there.
Wow.
And they'll command, where is this person? This one should supposed to be in class.
Yeah.
The way it is now, you guys are not there. So, that time there was no AI.
Yeah.
And it was hard, But again, I can't say it was hard. I love it more than now because mentor, you've been knowledgeable. You know your stuff.
Yeah.
Unlike now with this AI, I'm even worried. What kind of doctor are we producing? Because even in class, when you're asking questions, like you're stressing them. You're stressing them. I'm sure sometimes they look at me to say, why is this person troubling us?
Yeah.
When AI has everything. The time we'll be practicing, AI will provide everything.
Yeah.
But now look, I'm telling you there's a difference when you know and AI. AI doesn't know everything. AI doesn't have the experience on the word. Okay?
Yeah.
So when we come in class now, we try to bring this experience to students. They are not there, they are missing.
Yeah.
They say, no, AI or search, AI. Okay? Even the assignments that we give, you just take the question on AI, and most of the time you're asking them about the assignment, they can't even answer you.
don't know.
I'm telling you, the 21st generation, we are in trouble. Now, as lecturers, we have to find ways to help these students. For example, in my classes, I try by all means to engage them.
Yeah.
I always want to engage my students. Sometimes I push them, I'll force them.
Yeah. You force
I'll
us.
put pressure on them. She knows.
Yeah.
I'll put pressure, I'll ask the application aspect, I bring it in.
Yeah.
Even those who are not interested, and that thing that I like doing. If you're not answering me, I start from the beginning.
Yeah.
Everyone has to speak.
Yeah.
All that you see me do is try to overcome AI. We want you to grasp the real stuff, okay?
Yeah.
Reality. We want you to get close to reality. What is on the word?
Yeah.
Okay, the reality that is there. That is why you see me coming up with those practical questions, applications. Sometimes you think I'm troubling you because of our generation, where we're coming from.
Yeah.
It was application. So we want you also to apply, okay?
Yeah.
But although sometimes it looks like we're stressing you.
You know what, ma'am? We appreciate that. Even though we might not understand it, I think it's something we need and we appreciate it.
Yeah, and you guys are preparing for clinicals.
Yes.
You start your clinicals
Very
very soon.
soon.
I do go on the major ward round there.
Yeah.
I take pharmacy students there, and we have also medical students there. Okay.
Really?
There, you really need to prepare in advance. Actually, even before the major ward round, we should have seen those patients, and you're going to speak. It's before a multidisciplinary team.
Yeah.
You have the consultants, you have the registrars, you have the MA, those who are doing masters,
Yeah.
the 7th year, the 5th year, everyone is there. And we have pharmacists, we have nutritionists. Now, when there is that team, we want to share information.
Yeah.
Now imagine you go there, Zai, and you're blank.
You know nothing.
Dr. Nosia didn't prepare you.
Yeah.
That's why I trouble you like that, because I want when you go there, you are able to bring out what we teach you,
Yes,
to
ma'am.
apply, okay? There's a patient before you there. This is practical now.
Yeah.
If you need to give advice to this patient which is before, you have to apply to the situation in which they're in. You can't just get the notes as they are, the theory,
Yes,
and then you
ma'am.
start, no. Now this is application, and there's individualization. Each patient, it's a different situation there.
Yeah.
You need to look at their situation, which is different from the other. So now, if in class you just learned about theory, what will happen to this patient?
Yeah.
Whom you need to help and by apply.
Yeah.
That's why now we want medical students, when you are in class, guys, when lecturers are asking you questions, it's about practice. If you are asked, the more you answer, the more you give answers to those practical questions that we give you. You are practicing, especially when you're about to go for clinicals. You are preparing yourself. And most of the time when I prepare these, my questions for pharmacology, they are practical.
Yeah.
I put practical scenario questions. And sometimes when I'm marking, then I wonder, to say the AI students, I say, for example, give advice to this patient who was in this situation. They are going to download the notes.
Yeah.
No, you need to, you find that when it comes to adherence, they'll just talk about they should take their medication, they should what. But there is a situation. Maybe this patient has developed this problem because of maybe they used a long drug and there was drug interaction. So what advice are you going to give that it doesn't happen again? You may need to go into it and look at the mistake that they made, and then you counsel them accordingly. That's why now you need to look at individually. These patients, you look at them. In this regard, you can't just say one can't fit all.
Yeah.
Okay.
Yeah.
So you need to look at exactly. But now this is what we are facing. Myself, I face when I'm marking these scripts. Medical students, they are managing patients not in line with the situation. Generally, okay? Somebody is just saying the general aspect, and now you leave out the critical aspect, which is the underlying problem. Then this is a situation where now you find this doctor, when he starts practicing, has a long queue. Patients don't finish.
Yeah.
The same patient who I seen yesterday, they are back. The problem is still there, okay?
Yeah.
So if our doctors now start applying the practical aspect of it, you find that even when you're practicing, the patients you see, they'll get cured. They won't come back. And your number of patients will start reducing. Why? Because you are practicing what you were taught, and in this regard, it's a reality there. You're looking at these patients in relation to what they are going through individually, so you are not looking at them generally. And as a result, you find that you've mastered the art of managing patients. You find that you won't have a long queue. Because you've mastered the art. You know that managing patients is not about the general aspect. It's understanding the situation. What situation are they in? How can you solve this problem in short, okay? How can you solve this problem which is at hand, which is different from the other patient? Okay? So now, and with that you relate to them, you talk to them, and they will explain to you their situation, which is different. And they're going to handle it differently, okay? It won't be like you just use the Google. Oh, how do we manage this? Google tells you. Oh, this, Google tells you. And the patient will be looking at you. Doc,
do you know?
That's not my problem. My problem is, no, what can you tell me? I'm a doctor. I was in school for 7 years. I know it's better. No.
You don't.
You need to talk to your patient. You relate to what they are going through. They tell you their problem. And then, you know what, there's also what we call social epidemiology, where you look at these diseases, how they are spread in relation to the society that they are coming from, the social determinants of healthy. And this can come from patients, the social determinant of healthy. You know, when managing patients, it goes beyond just the biological aspect. There's also non-medical factors that the patient may be going through, and they will explain to you. And when you look at this social determinant of healthy, we are talking about where they are coming from, the environment, which is different from another. So you listen to them, and even when you come up with your care plan, to be very effective. Because every time managing patients, it's not just about drug. Sometimes just talking to them, where are they coming from? You've managed your patient. So we want that aspect. We don't want the Google doctors. We want them doctors who apply reality.
They know their things.
Yes, that's what we want. And it's exciting like that.
Yes, ma'am. Yes, ma'am. But ma'am, why do you think students still fail? Because we have AI and we have lecturers like you, but we still struggle sometimes, we still fail sometimes. Why do you think students still fail, even though they have all these resources?
Yeah, actually, with the medical students, you remember what I said myself? I said I didn't manage to get 6 points.
Yeah.
And I couldn't make it to do medicine. Do you know why there was 6 points?
Why?
At that particular time, medicine, it was in the university itself, it was what can I say? It's the cream, huh?
Yeah.
So what doing medicine there? It was a cream itself, on top.
Yeah. Yes,
It was when it comes to hierarchy, it was high up there.
Yes, ma'am.
Yes. So they needed students who were serious.
Yeah.
Committed.
Yes.
Okay. And that time they were serious. Okay.
Yes, ma'am.
Nowadays, we have families wanting their daughters to do medicine who are not even interested in medicine.
Yeah.
So these students are coming in to do medicine. They don't even know what it is. They don't even know what they are going to do out there.
Yeah.
They just say, I'll be a doctor. I'll have a title. And in my family, I'll be respected.
Yeah.
It's beyond that.
Yeah.
It's a service. Okay? This is a service. You give your life to save others.
Yeah.
Okay?
Yes, ma'am.
You save others. Those who are in need. Okay? You need to dedicate your life to them.
Yeah.
And if you decide to be a doctor, you will be saving lives. So if you'll be saving lives, there's a lot involved, and you're going to be interested in what you're doing. But nowadays, we have students who are doing medicine, they don't even know why they're doing it. Because things have changed now, you don't need 6 points.
Yeah.
So anyone is making it in the school of medicine.
Yeah.
So that is a challenge. That is a challenge. If I look back where I'm coming from,
Yeah.
sometimes it's very sad. You find that these doctors that we are training, they are not interested in what we are teaching. We are forcing them.
Yeah.
Okay. In my classes, sometimes I can tell to say, these students, even when I'm marking, when I like asking practical questions. It's actually, I always refer to my OSP exam as patients.
Okay.
I even tell my students to say, you've killed the patients. Majority of you killed them.
Yeah.
Because you managed them the way you were not supposed to manage them. You killed them.
Yeah.
You were supposed to give this type of insulin. You gave the wrong insulin and the patient died. It was an emergency. you choose the wrong insulin in an emergency.
Yeah.
There is there's ketoacidosis in DKA.
Yes,
And then you decide to give the wrong insulin.
Yeah.
The patient is dead.
You killed them.
So what I'm trying to say here with regards to why students are failing now, the reason why they found themselves in school of medicine, they don't know it. Okay. They don't know why they are doing medicine, majority of them, okay?
Yeah.
But there are a few, you can see the way they are writing and so on. So you find that they don't understand what medicine is. Medicine, it has a lot of topics.
Yeah.
That are about a lot of courses, and one needs to be dedicated. And you need to marry all of them. You do pathology, you do anatomy, physiology, pharmacology comes in now, the drugs to manage patients.
Yeah.
So you need to marry everything, even public health. I was just talking about social determinants of health,
Yes,
which also have influence on the treatment outcome.
Yes,
you
ma'am.
give your drugs, you understand your pathology, but this patient, where they come from, social determinants of health, the environment, where they are. For example, you're treating TB, where they come, there's overcrowding.
Yeah.
What are you doing? You're doing nothing. So a doctor needs to know everything, public health, pathology, anatomy, everything, pharmacology, you marry them. But now our students of nowadays, they just scatter them. They don't bring the courses together to say, I'm going to manage a patient, this may affect them. I need to know this, I need to know them. One, family influence, you need to do medicine. This
Yes,
and
ma'am.
that, you need to do medicine. So now we have these students who are lazy because they don't understand what they are doing. All they want is just clear. Okay, they write exams to clear. No, medicine is not like that. If you are doing medicine, you need to love it. You should
Yes,
have a
ma'am.
passion. It's so involving, guys. When you go on the ward round, there's a patient here before you.
Yes,
you need
ma'am.
to look at everything involved with this patient. Everything. You don't want to be in a hurry. You have to think everything. You look at the society where they're coming from. So now, if you just do it because everyone said you should do medicine, you're going to overlook some things that are very important. Okay?
Yes, ma'am.
So it becomes a challenge. So all I can say is that these students are failing because they can't manage medicine. It's so involving. It has a number of courses. So now, because they just has found themselves in the problem that they don't understand, so they just leave it like that.
Yeah.
They do what they can, not with a passion. So you find that if a student is interested,
Yeah.
interest is the first thing that someone should have. And when you have interest, and you know that you need to manage a patient, you're going to be worried. This patient that I'm going to manage, how will I manage them when I don't know?
Yeah.
I need to know public health. I need to know anatomy. So you find that now you love it. There are these students who have interest, they even follow me. No, madam, when you say this, what about that? Then I know, oh, this one is a doctor. This one is a doctor. He knows why. He has a passion for medicine. I have students like that. So I'm even happy.
Yes,
so,
ma'am.
oh, this one, when they be managing patients, it will be excellent.
Yes,
the
ma'am.
queue reduce. The patients won't come back, they'll be treated.
Yeah.
They'll be managed well.
Okay. Yes, ma'am.
Yeah.
Yes,
so it's laziness. So all I can say is students need to stress a bit. You don't sleep in, kill yourself.
Yes.
I never used to sleep for me to achieve what I've achieved.
Yeah.
You have to break nights. You sleep while your legs are upright. You sleep upright. In order to achieve. And actually when I was doing pharmacy
Yes, ma'am.
at UNZA, what used to happen is, if it's a medical student, we knew the way they used to walk.
The way they used to walk?
Yes.
How were they walking?
When they're from class,
Yeah.
they just walk fast to the room.
They're running.
Because pharmacy, at least, we had the few courses. It was tough, but our courses were few.
Yeah.
Medicine, there were a lot.
Yeah.
So you would just see, they just pass you. They don't stop on the way to chat.
Yeah.
Because they're doing medicine.
They don't have
but
time.
nowadays, medical students are chatting everywhere. What does it mean? they want in the forefront chatting. They don't even go. They hang around more. So that tells you that things have changed.
ma'am.
Yeah, somehow the programs are being, with AI coming in, it's making AI is good. It's come to stay. But what we are trying to say is, we should direct it.
Okay.
We for example, if it's an assignment, we set it first, we know what we are supposed, and then we tell it.
Okay.
We guide it, not it telling us what to do.
Yes,
okay?
ma'am.
Yeah,
Yes,
so
ma'am.
that's the way. Otherwise, AI is making our life easy, but it should not dictate. It's us to tell it what we want.
Okay.
Not where you don't know anything, just say, tell me this.
Yes, ma'am.
Even when we're marking these assignments, we can tell, oh, this is AI. This student did AI, they read through, they also prepared. But this one didn't do anything.
Yeah.
That is why now I've even changed with my assignment.
Yes, I saw.
I
our
changed my assignment.
We have to record ourselves.
Yes, I want audio, written, and audio.
Oh my
You tell me
goodness.
about what you are writing.
Yes.
Because it's easy, you just put a question and the AI gives you the answers. And then you give me, I start marking AI, I'm not marking what you've written.
Yeah.
So you tell me about what you wrote. Say something.
Wow.
So that audio helps me when I'm listening to it. Oh, this is a medical student. He knows what he's talking about. This is relating to what they've written. Good. Then I give you a max.
Okay. Thank you, ma'am, for giving us the tips.
Yeah.
But ma'am, what do you tell someone who says, I want to participate in class, I want to be interactive, but I'm shy. I'm not like Madam Nila. What's your advice to that kind of a person? They're naturally a shy person. They're not going to, be lifting up their hands. What can you tell that person to sort of encourage them to still interact with others and get out of their shell?
Actually, me, if you notice in my class, when I just come for the first time I'm meeting you, I tell you.
Yeah.
I give attributes for answering my questions. Do you remember what I said?
Yes, ma'am.
When I come in my class, I tell you. For answering my questions, their attributes are the bank somewhere for answers. When I'm marking your final exam, you miss out points, I'll go to the bank. Oh, Kuzai.
Yeah.
Was Kuzai? I'll go in my bank. I find your name is not there.
Yeah.
Oh, you got 45. There, you remain with your 45. If you're in my class, you are answering my questions, I go to the bank. Oh, Kuzai has extra 5 minutes, 5 marks here.
Yeah.
And she was answering in class. Got 45. She gets 50.
Okay.
So for me, continuous assessment is very critical for me. For me, the final exam is not so much important. What you do in class, I really appreciate it, and I give marks for that. Okay? Because those activities, they shape you. Okay. When we ask a question in class and you participate, you are improving your skills.
True.
Now, the issue here with students is that they feel embarrassed when they give a wrong answer. That's where the challenge is.
Yes, ma'am.
If they say the wrong answer. But me, even if you are giving wrong answers, I'm telling you, you are going to have marks that I keep for you.
Okay.
For giving wrong answers. Okay? And the other thing is that despite feeling shy that they'll give a wrong answer and so on. Some students are lazy. They're just lazy. They don't want to do anything. They just want to sit in class. They just bring their body. Huh? They just bring their body, they sit there.
Yes, ma'am.
And it's routine. Oh, class will finish at, she's calm.
Yeah.
Class will finish at. But for me, I appreciate, because medicine is practical. When these students start doing their clinicals,
Yes, ma'am.
there, whether you like or not, you speak. If you want, you're going to repeat your rotation.
Yes,
Okay?
ma'am.
So I try by all means to give an idea to these students how it is there on a major ward round, so that I prepare them. And I always prepare my students. I tell them, you guys, out there it's not easy. So start preparing well in class. That's why you see me sometimes deliberate. Through asking you, everyone has to speak.
Yeah.
If you don't want to speak, if you can't answer, just give it to the next. That's what I do. I say, please let it go around. If you can't speak, just, and every day. One day you can't just be sending to your friend. Tomorrow you say, she's coming, let me study. She's coming, let me study, you see?
Yes,
so
yes.
also we try by all means. For me, I appreciate continuous assessment. Well in class, it's more important for me. That's why you've seen I bring in these tutorials. You go in front, each one of you speaks. Again, I catch you there. If you refuse to speak, you're going to speak and stand in front.
Yeah.
I have a lot of tutorials that I give to my students. Why? I want to shape you before you go for your clinicals, so that you get used. By the time you're going there, somehow you would have acquired some skills, and you can be able to speak to people. You stand before your friends. You're able to give answers. Yeah. So what I can say is that those students who are shy, let me tell you this. When people are laughing at you, just ignore them.
Yes,
you are acquiring skills.
Yes,
the more you speak, the more you are shaping your answers, and the time you start your clinical on your major ward round, you are going to remember. And I'm not just saying it for the sake of saying. She's one of my best students who participates in class. She's excellent.
Thank you, ma'am.
And I really appreciate, and I'm really proud of her. Most of the time when I'm asking questions, she is there. And she has a bank with marks. The time she's on the side. The time she has a challenge, I'm sure she'll be able to benefit, because she answers most of my questions. Even if sometimes people give wrong answers, it doesn't matter.
True.
Yeah. So what I can say is that even if you give a wrong answer, people laugh at you. At the end of the day, they don't even know. So they don't know. You are better off, and those who laugh, actually, they're even worse. Yeah. And you've seen for me, the way I do it, that everyone speaks, it even shows. You even see them fail. Yeah. As it's going, you answered the wrong answer. Yeah. As it's going, you see them failing to answer.
But they were laughing.
They were laughing. So why should you worry about that?
True.
So you sharpen your skills as you answer questions. It really helps, actually.
Thank you so much, ma'am. So before we finish our interview,
yes,
what is something you would like to tell your students? Speak to your students right now, whatever that is on your heart that you feel, you know what, my students needs to know this.
Okay.
Yes.
Yeah, first and foremost, she's a very good example with this program she's carrying out, that's multitasking. So I would encourage the medical students to also identify your talents, apart from being a doctor, other things that you can do, business. I remember I had a student by the name of, Tamanda in the other class. She used to wake up in the morning, bake scones. Okay. Nice scone. The class that when she would bring me, I told her that my kids like scones. Yeah. She would wake up early in the morning, and I used to buy scones from her to what I like students who multitask. Yes, so medicine is not everything, guys. Yeah. If you look at now, our environment, things have changed. It's very competitive, okay? You find that there is no vacuum. Yes, immediately somebody leaves, it's occupied. Yeah. So what are you going to do? There is no space. You finish your medicine. What are you going to do if you can't find a job right away? Okay. So all I can say is multitasking. You diversify. You do other things that you can besides medicine, and you start early. Yes. By the time you are reaching my age, you have experience. Yes. Yeah. So that is very important. You do other things apart from medicine. Myself, I'm into entrepreneurship. I told you, I do business. I run a retail pharmacy. Yes, yeah. Ma'am. Now, after finishing my PhD again, I'm starting this program called Research Exchange Network. Okay. It's a registered non-governmental program, that will be helping PhD students. Also, that will help you earn money. There are these PhD students who are consulting. I just graduated last week on Thursday, but I'm already doing this. I planned earlier, like you are doing. You've seen, huh?
Yes, ma'am.
So maybe this program, it was registered while I was doing PhD. So we need to start early, so that by the time we become doctors, we know other things that we can do. Your friend will just be sitting waiting. You are doing other things because you are equipped.
Yes, ma'am.
So entrepreneurship, any other thing that you can do apart from medicine. Our young medical doctors now, we want them to do a lot of things, different things, to diversify. Okay.
Yes, ma'am.
Yeah. And then the other thing is that to have a passion for medicine. Medicine is a service.
Yes, ma'am.
You have to give. Okay. You have to give. If you don't have a heart to give, I'm telling you, the word will be boring for you. Because you go out there, you just find these people with problems. And you get tired of the way of problems.
Yeah.
But when you also, as a Christian, I'm a Christian myself, I'm a born-again Christian.
Yes, ma'am.
So as a Christian, you know that you need to, God encourages us to love others.
Yes, ma'am.
Okay?
Yes,
You need to love others. So you need to have a passion for your patients. You should love them. Of course, the word of God will help you love them more.
Yes,
because,
ma'am.
you know, Jesus died for us, you know. He gave his life for us.
Yes, ma'am.
We are here because of the love. Imagine he gave his life. So even us now, you guys, me, I'm a pharmacist, quite all right, but I train doctors.
Yes,
so I
ma'am.
know what it is. I also go on the ward. I know what the major ward round is involving. I know everything about that. So you should have a heart for your patient. You should love your patients.
Yes, ma'am.
That's why you need to love medicine. If you don't love medicine, I'm telling you, to bore you.
True.
Medicine is not an easy profession, because sometimes you go for work 8 hours, you have to leave the following day.
Uh-oh.
And what are you doing? You're with patients. And sometimes the wards are not even conducive for you.
Yeah.
Some wards, there are all sorts of diseases. For example, in some wards, if you go, for example, in A block there for where there are children,
Yeah.
you know, sometimes these children, there's heat, they put those temperature, and you know, temperature, and these children have diarrhea, and the environment itself, you find that the environment is not even conducive, but you are there. Why? Because you love them.
Yes,
you are
ma'am.
there. So medicine is a profession that requires one to love. Okay?
Yes,
you
ma'am.
need to love your patient. Without love, it will be very hard for you. You even fail to stay there. Okay? So you need to have a passion for medicine. And this passion that you have for medicine again, well, yeah, it starts from class.
Yes, ma'am.
You need to apply. Not theory. Theory is not enough. You need to apply as you learn your pathology, you learn your anatomy, your physiology, even pharmacology. You marry them.
Yes,
and then when you bring them together, now you manage your patient the way you're supposed to manage your patient, with love and with knowledge, because knowledge is power. You know, when you're managing a patient without knowledge, you end up making wrong diagnosis.
You're not
Okay?
confident.
You don't even do the differential diagnosis, you just treat the condition the same.
Yes,
Okay?
ma'am.
So all I can say, my last word is that have a passion for medicine, which you're doing, and also diversify.
Sure.
Do many other things, so that as you progress with your career, because me, I'm a career woman.
Yeah.
I diversify. You've seen the things now. I'm a public health specialist.
Yes,
So
ma'am.
in case this fails, there'll be something else.
True.
This failed,
There'll be
and
something.
out there, guys, is competition. There is no vacuum. When you finish as a doctor, you have nowhere to go. You want to be employed immediately.
Yeah.
And immediately the person maybe stops working. There's no vacuum. Another person occupies it. It's competitive. So now, if it's competitive, who is going to have this chance? The person who is knowledgeable. If you are not knowledgeable, you go for the interviews, you're not going to pass. They'll
Yeah.
leave you.
Yeah.
So it's competitive. You don't need to relax, okay?
Yes,
So I would just like to encourage the medical students to go an extra mile
True.
as they do their medicine. That's what I can say.
Wow. Thank you so much, ma'am. I think my friends are going to love this. The audience are going to love this.
Yeah.
Yeah.
And I love the medical students. I enjoy lecturing medical students.
We can tell.
So
we can
please
tell.
continue
Thank
with
you,
whatever
ma'am.
you're doing. And I would also want to encourage, continue with this.
Yes, ma'am.
Yeah,
Thank you.
you are going to help others to understand what medicine is.
Thank you,
Like
ma'am.
I said, people need to understand. Some don't know what medicine is. So this program that you brought, it's excellent.
Thank you,
People will
ma'am.
understand, and now they will even know why they are doing it.
Yes.